it's my pleasure to introduce Florencia, who I've known for many years. She has a PhD in economics from Oxford, and she's currently a professor of economics and applied psychology and the director of Global Ties for Children Center at New York University. But before joining NYU, and when I met Florencia, she was working at the Inter-American Development Bank, where she worked for 15 years, and she led the Early Childhood Development Group, the IDB ECD Innovation Fund, and an initiative on behavioral economics and social policies. And she advised governments in Latin America on the design, implementation, monitoring, and evaluation of public policies on child development, social protection, and health. She's a founding member and former head of the Latin American Economics Association, Behavioral Insights Network, and she was also founding member of networks of women economics globally and in Latin America and the Caribbean. So it's my pleasure to introduce Florencia, and I'm sure the talk is going to be super interesting.
Hello, good morning, everyone. Can you hear me okay? Okay, so it's a pleasure, and I thank the Thrive Organizing Committee for inviting me today to share some of my work and my thoughts on how to invest better on child development policies. As Helen was saying, I spent a lot of time at the Inter-American Development Bank working hand-in-hand with governments on the design, implementation, and evaluation of child development, social protection, health policies, and so you will note a strong focus on Latin America in my talk, and a strong focus on government-led interventions. And I joined NYU last November, so there's going to be a lot of the amazing work that Global Ties for Children has done. I will also use a lot the human capital terminology because I'm an economist, and I think that's one of the main, if not the main tool to break with intergenerational transmission of poverty. And let me give you an overview of the talk. I'll start with the context, the challenges for child development policies, then what works in terms of improving child development outcomes, reducing inequities, and in the four, to me, most relevant interventions today, so not 20 years ago, but today. So parenting programs, center-based care, childcare and preschools, and the remote and hybrid modalities of the A and B, to put it simply, and the more ad hoc humanitarian interventions that mostly the Global Ties work. And then I end on where do we go from here, so what's the next frontier and key takeaways. So the big umbrella of child development policies is development, so the Sustainable Development Goals, and while the 17 SDGs are great and very ambitious, 169 targets, a lot, current investments from philanthropy, governments, multilaterals as well, have done some good results, but very, very few are great. I think many will agree with me that they're still failing a lot of people. We know about the learning crisis, and we already knew pre-pandemic that most of those targets were not going to be met. So in the world we live today, with more needs and less funding, it seems that we cannot do everything, so we should really be focusing on smarter spending and do the best first. So after discussing these challenges, I'll be providing evidence on a set of high-impact policies that are also cost-effective, with the aim of informing policymakers in a way to make those decisions on the most cost-effective interventions to do this the best first. So coming from the SDGs to child development, I don't need to justify with this audience, but we all know this is a unique window of opportunity to invest in human capital, is where the basis of learning, health, and future productivity are set. That is the most cost-effective investment. There is the Heckman study from preschools in the US, 13.7% rate of return. I have just finished an analysis of the home visit program in Jamaica and submitted it on the returns on investment from that program with the long-term effects on wages and the cost analysis, and it's about 12%. It doesn't include crime or health impacts. It was difficult to do that, so it's around that. That's the rate of investment. It's the highest among all social investments. Not investing is very costly. The cost of inaction described as the cost to societies as a whole of not investing today in early childhood, but that cost tomorrow. We actually calculated, I see some of the co-authors of the Lancet series, Giri and Gunther, and there might be others, is 1.6% of the gross domestic product. And because caregiving responsibilities fall on women, these policies also will have a higher benefit-cost ratio because they benefit the care economy and women's equality. So, okay, challenge number one. So expand coverage, although I have this Latin American setting, is still an issue. We know that enrollment, attendance in child development services is still super far from high-income countries. If you see, I know the laser doesn't work, but 15% of Latin American children 0 to 2 are attending an early childhood care and education center, as compared to 68% in OECD countries. For the 3 to 5-year-old, sorry, to 43%, so the comparison is like that. So 15 to 43%. Almost 7 out of 10, 3 to 5-year-olds are attending an SCC center, as compared to 9 out of 10 in OECD countries. But as you can see in this graph, heterogeneity is huge among age groups. So you can see 50 percentage points of difference for Latin America, but you look at Peru or look at other countries, and it's a large heterogeneity across age groups and across countries. I mean, compare Guatemala and Paraguay with Costa Rica, for example. Family support programs, parenting programs delivered through health services, home visits, community centers, groups, you name it, have a still very limited coverage in Latin America. The only exception is probably Crianza Feliz with its ups and downs. And they are marked with a little star. Those are the countries that have some kind of established, but it never goes more than 100,000 kids, national coverage in general, and they have challenges in terms of uptake, acceptance, and targeting of the most vulnerable kids. I wanted to go a little bit deeper into the ECC coverage, and just to show that if you look over the ages of these 0 to 5 children, attendance increases very sharply with age. It's really clear that there is a huge jump for 3 to 5, and that there are differences across countries once again. You can see that, I don't know, Argentina and Chile are reaching universal kindergarten, while in Colombia there's still a 80% attendance rate. The second challenge is quality. We know is key for the effectiveness of interventions, but it's still extremely low in most places where we have measured it. For example, this is a measure of structural quality. The number of children per caregiver, or that student-teacher ratio in the education literature, is up to 5 times larger in Latin American countries than in the United States. And process quality, so the quality of the child, the children with the caregiver, this is the class indicator actually, presents really low scores. From Argentina and Mexico to Peru, Ecuador, and Bolivia, the scores are really low, particularly for the engaged support for learning. And I wanted to dig deeper on 2 countries, Brazil and Argentina, that have increased access dramatically over the last 2 decades. So access is almost universal. And what I want to make, this is the point of access is not enough. Access has been there for a while, and quality, so the infant and toddler environmental rating scale in Brazil shows that 50% of the creches, of the childcare centers present inadequate quality. Only 3% are good. And this is not a mistake of the graph. There are none that are excellent. The distribution in Argentina, this is from 2019, is also showing that for emotional and behavioral support, the distribution is around the 5 out of 7 points, and it's on the yellow-green. It's not that bad, but when you look at engaged support for learning, that is what supports cognitive development, it's mostly on the red area, so it's really, really low scores, really bad quality. To end with the challenges, given everyday's sobering news, you might think it's really a bad time to be a child and a caregiver today. It is true, though, that children are better today than a generation ago. We think of poverty, malnutrition, mortality, morbidity, but there is a shameful amount of challenges. 70% of children cannot read a simple text by age 10. There are more displaced children than ever since World War II. 1 out of 5 children are growing up in a conflict-affected country. 50%, half of the children are living in a country with high climate events risk, and those risks are most harmful for young children prenatally and for infants and toddlers because of heightened neurobiological plasticity. And if it's not war, social unrest, or climate change, poverty. Poverty is still preventing children, many millions of children, to achieve their full potential. So, taking into account all these challenges, let's look at what has worked. These are the 4 type of interventions I mentioned, and let's start with parenting programs. So this is basically, this graph is the graph about the voltage effect that John List was discussing last night, and for parenting programs. So it's depicting the challenge of scaling up with quality. So here we have the 62 children treated in the Jamaica Original Jamaican program that was replicated in Colombia with 720 children. We have number of children here, impact sizes. And then in Nicaragua and Peru, the programs were fully implemented by the government and at scale. So it was in their hands, really, no research team. And it's pretty clear, as we were listening at last night, the larger the impact, the lower the impact, like a third the impact and then another third cut. But although this is the story we have been telling, if we look at all the results, so reach up or not reach up curriculum, although these sizes are small, they still yield benefit-cost ratios that are pretty acceptable. So let's look at that. The Peruvian CUNAMAS evaluation, for example, 0.10 standard deviation, I think is really small. 5.4 benefit-cost ratio, it's not that bad for a social investment. Nicaragua, 11.7. This is work I finalized last year. We also see that quality is an important component of this. The larger the quality indicator, the larger the child development outcomes. We also show that community monitoring is a low-cost strategy to keep as a quality improvement mechanism. In Brazil, in the Cresça com Seu Filho parenting program that was integrated into the public health care system, the Estratégia Saúde da Família, there was a modest impact on parenting, but no effect on child development. And we know that there was issues with workload, with supervision and buy-in from the delivery actors. And then groups seem to be effective to improve child development in the short run. There was evidence from Jamaica, but benefits faded by age 6. But there was no impact in the Boa Vista, Brazil, in Brazil, the last trial. And the key factors for that implementation to yield positive results are listed here. So structured curriculum and training, like in the Peruvian model, dosage and take-up, that's what didn't happen in the Brazilian example. Community involvement and leadership, that's what did happen. It did happen in Nicaragua and other examples. Okay, so let's go to the center-based program. So if you think about the main loan portfolio for the Inter-American Development Bank, I'm sure it's the same for the World Bank, most of the big chunk of money for child development policies go to infrastructure, goes to the construction, expansion, and improvement of childcare or preschools. So from that work, we learned, and also looking at the global literature, that preschool, that in Latin America is 4 or 5-year-olds, and that it's been universalized and it's made mandatory since, in particularly the southern cone countries, is pretty consistent. We find positive impacts on child development, some medium run on learning, and on women labor force participation. For the youngest, 0 to 3, the literature was more mixed, with high-income countries showing actually negative effects. But again, by looking at the experiences of the IDB lending portfolio and the global literature, we saw that positive impacts tend to appear when the intervention is done with the most vulnerable populations, and when the quality of the counterfactual care is lower than the childcare service. So for example, Nicaragua, I was the team leader of a loan that expanded childcare, and one of the things we learned is that coverage can increase really quickly. So it went from 1/4 of children to 3/4 of children being covered within 1 year of the construction of the childcare centers. This also benefited child development and mothers' labor force participation. They are the main caregivers. That's why I'm saying mothers and not caregivers. But they increased 20% their employment rates. The results were also driven by quality. We measured quality, and we saw some moderating effect. And the benefit-cost ratio, once again, is 6.2, which is pretty good for a social investment, once again. Effective factors for implementation, process quality, emphasis on the workforce, structural quality, and something we don't talk so much in the child development literature, which is attendance. We saw in Uruguay a few years ago that the chronic absenteeism in preschool is 3 to 5-year-olds, was much, much higher than in other levels of education, because parents didn't value the preschool. They say, well, he can go one day and not the other, and if it rains, whatever. So we partnered with the Ministry of Education and sent behaviorally informed messages about the importance of preschool, about how to ensure that if they wake up early, they can get to school on time. And it didn't actually improve attendance for children on average, but it did improve those in the median of the distribution of absenteeism. So, remote and hybrid programs. So we learned during COVID that many services were disrupted, so services couldn't be provided, and countries provided alternatives, flexible alternatives such as WhatsApp, printed materials, SMS. And in this map, you can see some examples like booklets and materials from Latin America. In Panama, phone and video calls in Ecuador, the Boa Vista remote program via WhatsApp that was quite successful, a few examples in Uruguay and Jamaica. So the crianza positiva, I see Juanita is sitting there, she can tell you more about, but there was no impact on any outcome, while the remote delivery of the REACH program in Jamaica that was published in Pediatrics a couple of years ago showed no impact on child development, but good impacts on parenting. What was the difference between these two? There were some in-person contacts in Jamaica, while in Uruguay it was fully remote from beginning to start. So it seems that even some in-person contacts do make a difference. Hybrid modalities. So combining in-person and remote seems to be a promising approach, not only for cost effectiveness, but for logistics when there are shortages of human resources. That's another example from Uruguay that was presented in a poster there. When there are conflict, when there are very hard to reach areas. And these, there is also the poster of the Jamaica hybrid modality that combined in-person and remote. There were every 2 weeks a phone call, every 2 weeks an in-person home visit, and with substantive child development impacts and a benefit-cost ratio of 12.3. If you are following my line of thought and you are comparing all the benefit-cost ratios I'm presenting, that's pretty good. So, and we are currently exploring the feasibility of a hybrid model. I'm going to talk more in a few slides. In response to gang violence and very restricted in-person preschool in Haiti. okay, humanitarian interventions, this is amazing work by my colleagues at Global Ties in the Middle East and soon in Haiti. So the question was, there are no preschools, there are no physical preschools in refugee camps. Can we provide remote preschool in a conflict setting with Syrian refugees living in Lebanon, or living in Iraq, or living somewhere else? And the answer was yes, with training of preschool and working, leveraging parents, the caregivers. So that was a partnership with International Rescue Committee and SESAM Workshop for what was called, and we're going to be calling RELP, the Remote Early Learning Program, which had 5 to 6 child or caregivers per class. Every teacher had about 10 to 12 classrooms, and these were 35 to 40 minutes WhatsApp calls 3 times a week for 11 weeks. There was some distribution, only one in-person contact, only one, just to distribute a backpack and some stimulation materials, arts and crafts and picture books, etc. The results were measured with a randomized controlled trial in Lebanon, and there were quite important impacts on child development. The IDELA measured 0.21 to 49, and from RELP. But there was no moderation by parent literacy, which is interesting because that means that the program also worked for very low literacy parents. There were questions at the beginning of the program of whether they might be able to understand the materials, because again, there is no preschool. It's a teacher just 35, 40 minutes, 3 times a week, and then it's the parents that are doing the activities with the child. There were improvements in other outcomes, less parenting stress, better interactions with the child, and a decreased caregiver anxiety and depression. They didn't measure the benefit-cost ratio, but we'll get to that at some point. And in Iraq, the magnitude of the gains were similar to the Lebanon. And as I said, we're starting a pilot of this modality, but of a hybrid one, not fully remote, in partnership with a grant from JPAL and partnership with Inter-American Development Bank. And the idea is that these children in Port-au-Prince, which is the area where there's a lot of violence and conflict and gang activity, have been out of school for about 1.5 years. So there are thousands of children. So for those children, there's going to be a fully remote program because they are just unable to even reach preschool. But there is one school that is running in Port-au-Prince, but Heskio, this is this amazing NGO. And for that school, when there are conflict and children have to get out of school, they cannot attend. So this hybrid RELP will activate for them when they cannot come to school. So the other brand of work from Global Ties is about remedial tutoring and social-emotional learning in crisis settings. This was a lot of randomized controlled trials and diagnostic studies in Lebanon, Niger, Colombia, and Peru. And here, the question was about whether remedial tutoring, so after-school programming, could improve children's academic outcomes and social-emotional skills in particular. And this, once again, leverages IRC, the International Rescue Committee Healing Classroom Intervention, which is a learning program that aims to improve particularly social-emotional skills for children that have been subject to trauma. There are activities that are from 10 minutes to a maximum of 30 minutes, so this is having the child in mind, very conscious set of activities. And we go from mindfulness to brain games, activities for function skills and focus on attention, short-term working memory and self-control. And during 2016 to 2017, IRC implemented that in Lebanon and with locally displaced children in Niger. So a full year of intervention in Lebanon led to better behavior regulation in children and a full year of these healing classrooms to better literacy, gains in literacy and math. Global Ties has also partnered with Colombia and Peru to develop, because it's not all about RCDs, to develop tools for assessing socio-emotional learning, which in conflict-affected settings seem extremely important to be measured and act upon. So I'm going to be finishing. I showed you mostly, as I said at the beginning, government-led interventions. I think the only pilot I probably mentioned was the Jamaica one, how one couldn't mention it. I mentioned benefit-cost ratios a lot when available in the studies. And of course, there are still many questions about how do we improve the design, the implementation of the interventions to achieve what we've been discussing a lot yesterday, fidelity of the interventions, quality so that we achieve the full size of the impacts and not a reduced voltage effect, as John was saying last night. But regardless of that, those question marks, I think the big question marks are in these 4 issues. We still do not know well how to address the mental health needs for children and their caregivers in low and middle income countries. We do not know really well. There are some emerging literature. This hybrid modalities literature is one part of it. The consequences of child migration. Highly mobile families, we don't know how to meaningfully interact with them to have large impacts. And the new thing of how to address climate change and environmental contingencies. Once again, maybe hybrid modalities when there is a crisis can help. A new thing I've been seeing a lot, and you probably see that emerging thing, is screen time in the 0 to 3-year-olds. A lot of parents putting their phone in the stroller, in the restaurant, 0 to 3-year-olds. Remember, American Academy of Pediatricians bans the cell phone for the 0 to 2. And I just wanted to briefly mention that because I'm not seeing it much in the discussions. I saw, I think it was a newspaper article about a study in Catalonia. This is n = 1, so economists will not be happy, but this is what it is. And I think we need more of these kind of things. In Catalonia, one childcare in Catalonia, they saw, this is absolutely mad, children 0 to 3 spending 3 to 6 hours a day on a phone. So I was listening to Sarah's presentation yesterday of these children in the camps left alone. There are many children in low and middle income countries, so this is Barcelona, whatever there is, but alone, but in other more middle income countries, they're left with a phone, without other supervision, without meaningful interactions. And in that daycare, they measured there are 75% language delays in this population, 46% identify feeding difficulties, very low tolerance to frustration, of course. So we are not also realizing that this is more acute of a problem for low socioeconomic status mothers because they have time poverty. So coming back to also some of the presentations yesterday. So again, the full issue of presenting two-generation interventions is extremely important because this is not anymore, they are spending like just a few minutes. It's in 3 to 6 hours is a lot, and it may be even a threat to the effectiveness of the policies we have been talking about for this last day. Key takeaways. So I think expanding access is still a sine qua non. We know, particularly in the other regions in sub-Saharan Africa, is key for conflict-affected children that, like the Haiti, Port-au-Prince kids, 1.5 years out of school. And the most vulnerable and hard to reach are the priority population for access expansion. And for that, there has to be some creativity that we need to select and adapt delivery, remote, hybrid, chatbot, groups, you name it, to fit the local context and the children's need. Here, I'm thinking of the remote and hybrid modalities in Jamaica, the RELP in Lebanon with Syrian refugees. I didn't mention it, I forgot. In Argentina, the REACH-UP model has been delivered, I think, for the first time in childcare centers, and is showing positive impacts in the Bailey 3 for delayed children. So we cannot do that for all the children. Children that present some delays are offered an stimulation program in the center, so that there is not the issue of take-up and acceptance I was presenting at the beginning of home visiting. But of course, expanding access, I try to make that point, is not enough, and we need to improve quality, particularly the quality of caregiver-child interactions process quality, which requires huge, huge investments in the ECD workforce, training, supports, coaching, working conditions. I think there is still a need of addressing these knowledge gaps that I mentioned before, and prioritize, and prioritize. I think that that's my last point on. We have, I think this was mentioned by Sonia at the beginning yesterday, answer policymaker questions. Many were discussing this yesterday. Just putting the policy recommendations at the end of the paper is not enough. Making a policy note is not enough. Going to conferences is not enough. It's just engaging with policymakers once, again and again and again, and see when the policy windows open, jump in, and see meeting them where they are. While also working, and this is, again, in tandem with governments, for those changes to be permanent, and without legislation and funding, a funding line for child development is very, we don't see that much. There are very few countries, even in Latin America, that have a funding line. And last but not least, I think with high impact policies that also have high benefit-cost ratios and cost-effective interventions, we can help policymakers to have a menu of options for them to do the best first. Thank you.